So we're here with Daniel, Rich, and Brandon from Healthspan, gethealthspan.com. And they're researchers very much involved in anything that makes your body healthier and makes you live longer and makes you live healthier longer. That's the main problem. The main problem that people have usually, where it's not just how long we live, but how well we live. And of course, when it comes to the issue of sugar intake, this is something that they all talk about frequently. Daniel did an interview with Fox News about it, which was very interesting, I thought. And the main point that was really fascinating for me to read about is that high sugar intake can actually make you get older faster, which is what nobody really wants. We want to stay healthy, but we want to get older and not look older necessarily. So Daniel, when you hear, especially lately, there's been a fad, well, I shouldn't call it a fad necessarily, but the sugar diet is something that was out there. People were saying, hey, if you can eat a lot of carbohydrates, but you're cutting back on the other macros, you're cutting back on your fats and proteins, you lose weight, and it's fantastic. And of course, we know this works with pretty much any macro. If you just focus on one macro and you neglect the others, you might have some short-term weight loss, but there's usually problems associated with it. Now, when people follow a ketogenic diet, of course, we're cutting out all carbohydrates and we're focusing on proteins and fats. There's some medical implication that this is healthy. But what happens if we, cut out the fats and the proteins and we focus on sugar?
I think this is just it's such a broad question. When I was asked this question by the Fox News host, I'm like, well, there's a whole array of things that go awry when you chronically elevate your glucose levels. Everything from a hormonal response where we see the parallel increase in hormones that increase the growth of unhealthy tissue. So when you're chronically having higher levels of glucose, you have increased levels of insulin and increased levels of a hormone called IGF-1 that both have their growth signals for healthy cells and unhealthy cells. So senescent cells, tumorigenic cells. In the modern American diet, the standard American diet, we see the chronic elevation of glucose levels, chronic elevation of nutrients. And so from a cell signaling standpoint, we just see constant growth signals, which is good in one stage of life, in a developmental stage of life. But as we get older, we're seeing the growth of some really unhealthy tissue, the senescent cells that have had some damage incurred to them. But as a kind of evolutionary response, the damage is halted by putting those cells in an arrested development stage. So they also are highly inflammatory and they inflict damage to the tissue that they're in. Mm-hmm. So we see that that glucose, those elevated glucose levels, stimulate the growth of those cells in particular. And the same thing, and Brandon and Rich can speak to this because they're the experts on this. And cancerous cells, they are highly ravenous for glucose. And Brandon has some research that he's done on ketogenic diets that show there's a lot of unhealthy cell growth of these cancer cells. He's presented a poster based off of his research on glucose and the kind of the advantage that cancer cells have in the consumption of glucose. But this is not just one dynamic of elevated glucose levels being kind of maladaptive to Healthspan. If we look at advanced glycation, we see kind of the deterioration of the cellular environment, how proteins get tagged with a glucose tag, we call these AGEs, and how that creates a lot of dysfunction within the extracellular matrix. But in endothelial cells, across the board, there's a lot of diminishing returns on mitochondrial function when we're constantly kind of providing excess levels of glucose that makes it that mitochondria are no longer functioning in a way that they were when we're really sensitive to glucose. So it's a whole cascade of events that don't serve an individual's health span.
Yeah, and I had a question. So you're bringing up two good points here. So one is the detrimental effect that sugar has kind of on our mitochondrial health, right? Where we know that the mitochondria, when they get overloaded with sugar, they produce copious amounts of ATP, of course, but at the same time, we might produce too much energy, and we might have an issue with also producing a lot of free radicals there, right? Which need to be neutralized, which can be damaging. So that's on the inside of the cell. But beyond that is also what you mentioned, which was interesting to me. These glycation end products, these advanced glycation end products, these age molecules that form, that is sort of independent of mitochondrial demise, I suppose, because it's in our tissues, they distort our collagen. And when we talk about aging, what's the one thing that people want more of is collagen, obviously, right? And when we are consuming this, to me, it's like we know that when we're grilling a steak, we will have these advanced glycation end products also forming by charring the steak, right? That's what the crisp stuff that tastes so good. Or we're caramelizing onions. We like the taste. So we're consuming them externally, but also endogenously, so inside our bodies, when we're consuming a lot of sugar, a similar thing happens, right? Where we're distorting them. These two things that you alluded to, that's, of course, massively. And then, Brandon, we brought up briefly about the ketogenic diet, just to say this again. Now, again, this is focused on high sugar. Ketogenic, very different, right? Here we focused on high fat, moderate protein intake, and very low sugar, right? And what happens there in the mitochondria? So when we compare these, so here we have mitochondrial, as Daniel just pointed out, this is very destructive because we are actually causing problems in our metabolism there because we are overloading mitochondria with the simple sugar. What happens in a ketogenic situation there?
Well, I think and we've talked about this previously, is that the metabolic flexibility is a super important component to all this, that you want to have the ability to kind of navigate back and forth between the two. But I would rely probably foundationally a bit more heavy on, being able to use fats instead of relying on glucose. And to kind of tie it into at least the cancer aspect, as Daniel pointed out, and Rich was obviously part of that study too. This was a breast cancer cohort that you can actually see a 360 of the FDG PET imaging where they fed, fluorodeoxyglucose, which is a fake kind of glucose, which doesn't raise blood sugar, but you can still inject it and see how aggressive those cancer tissues are to attacking it. So it's like a thing. There's not really any argument to that. But we know that when we eat glycolysis upgrades, you generate pyruvate, you generate acetyl-CoA, enters the TCA, and then we have this kind of flooding going on with the electron transport chain and oxidative phosphorylation. And so when you have these copious amounts of ATP production, which you pointed out, Dr. Kune, there's kind of like if we finished up this podcast and went to the bar and had too many drinks and then the bouncers kicked us out, there's a mechanism that's built in called uncoupling protein that is like, these guys shouldn't be here anymore. Like, let's kind of get them out. And usually that's associated with things like thermogenesis. People do it for cold therapy, and it's a good thing to a degree. And I think we see the weight loss results with that, with people that are doing this, high sugar fad diet. But I certainly wouldn't recommend it for somebody who is metabolically inflexible. And I think that's a majority of the population. So even if you look at like the CDC data, either pre-diabetes as evidenced by A1C or fasting glucose, and then coupled with type 2 diabetes. So if you pair those two together, that makes up about 54 or so % of the population, meaning it's more normal to be unhealthy than it is to be unhealthy. So if you put somebody in this bucket and told them to eat a bunch of Sour Patch Kids or Swedish Fish or drink a Coca-Cola, whatever the heck it might be, they're probably in big trouble because of that generation of oxidative stress that's going to happen specifically within that electron transport chain, specifically at complexes 1 and 3, where you're going to just have to like dump. So yeah, weight loss is cool, but the kind of accumulation of oxidative stress is not cool, and you're going to be in big trouble.
Right. Yeah. And you're right. I mean, about people being metabolically unhealthy, that's unfortunately the majority of the population. And that's why usually, I think we used to take in higher amounts of sugar, but we were also metabolically more healthy. I'm thinking back to a study that was done in the 1940s. That was the Minnesota starvation experiment, where they tried to figure out what is the average intake in macros and total calories of people before they put them on a starvation sort of diet to see what happens to their bodies and parameters. And I think back then, the caloric intake was much higher, but people were metabolically healthy, and they took in up to a pound of sugar per week. which was not refined as simple sugar still, right? I mean, they had pastries and all that back then, but they did better. And I was going to ask this to Daniel, actually. So what do you think in terms of us being less healthy when today, I mean, if you're very metabolically healthy, Daniel, and you've taken in high amounts or higher amounts of sugar, I see this in children, they usually do okay with it, which doesn't mean that we should just say, oh, they can get away with it. Let them eat all the sugar they want. No, that's probably a bad idea, because it's a slow process where we slowly go to this insulin resistance point. That's always what we discuss when we think about mitochondrial dysfunction, right? And it doesn't happen overnight. Obviously, it's something that happens from early childhood on. And now we have childhood obesity, of course, which is much more prevalent, which we didn't really have back then. People were much thinner. But then, so today, when we're metabolically less healthy and we're eating high sugar, so what happens to our health overall?
I mean, we're talking about severe metabolic dysfunction, and it's not just like type 2 diabetes. The metabolic dysfunction kind of pops its head up in all the age-related chronic diseases. So if you look at Alzheimer's, you become less capable. There's diminishing returns on glucose as you get older. So there's a kind of this trend of calling Alzheimer's type 3 diabetes, where the neuron is less capable of metabolizing the glucose. So in cancer, the cancer cells are better at utilizing they have more transporters on their cell membrane, able to utilize the glucose in a way that gives them an advantage over normal healthy cells. When you talk about heart disease, you see kind of the endothelial lining being more inflamed because of the oxidative stress of the glucose. So it's not just metabolic dysfunction in the way that we think about type 2 diabetes, but it's every age-related chronic disease. That's why it's kind of so integral to the concept of Healthspan.
Right. Yeah, that makes a lot of sense. And then I think, Rich, you also were involved in the kind of study that cancer uptake. Of course, that is one of the major issues. So I would say, from the perspective of, again, if someone wants to follow a diet to lose a lot of weight, I think if you cut out 2 of your major macros, you will always lose weight. But the problem is, of course, what happens health-wise in that time, and is it sustainable? And I would argue here it isn't, because when you eat high sugar and you're cutting out your fats into your proteins, the fats and proteins are 2 macros that are essential. We need fats and we need proteins, we need amino acids, we need building blocks. We cannot generate those from simple sugars. So it's not a great idea to focus on it. But beyond that, again, the risk is cancer cells love sugar, and I talked in other videos about this, and it's because they're primitive. Their mitochondria are usually dysfunctional. So our mitochondria have this elaborate citric acid cycle that we had to learn in biology, where you make, I think, 36 ATP from 1 sugar molecule, right? When everything goes right, in the presence of oxygen. Now, if that doesn't, if cancer cells cannot do that, so they go back to a primitive form of energy formation, which is called fermentation. And I think you only get 2 molecules of ATP per sugar molecule. So it's a shitty energy balance. It is not good. That's why they're guzzling sugar. Then, of course, they have a second substrate, which we found later, which is glutamine. We can talk about that at a later point. That's an amino acid. It's a non-essential. So that means we make it on our own. That can also be used. Not every cancer cell, there's variations, but some of them can use it also effectively, right? But sugar is the main food for cancer cells. And then if someone has cancer, now we put them on a high sugar diet. So maybe, Rich, you can elaborate a little bit what you think, what your thoughts are, if that's a good idea for the general population, which now is at a much higher risk of cancer. It's about 30% now lifetime risk, where it was 2% or so in the 1920s or 1910s.
Yeah, definitely. Thank you, Dr. Kune. This particular diet fad, it's interesting in some ways, kind of keys off of this FGF21 marker that popped up in the research. And the studies back to at least 2016 and maybe a little bit before then do suggest that if you overconsume sugar, reduce protein, reduce fat, you can upregulate this FGF21, which ends up, like Brandon had mentioned, it makes you a little bit more energy inefficient. There's some uncoupling that happens. So it can promote some weight loss. There's other ways to go about upregulating FGF21 if that's your goal. There's a couple caveats, I guess, in this particular instance with this sugar diet, which I guess it's maybe 3 to 4 weeks old at this point in terms of its popularity kind of spiking a little a few weeks ago. So things to keep in mind. Some of the people that were doing this, like the YouTubers, for example, that kind of at the epicenter of this, lean, heavily muscled, well-trained, exercise a lot, metabolically healthy, and then in some cases like using anabolic steroids. It's a very different setup for the general population, as we talked about, where the metabolic health is not quite where it could be. And then, 93% of Americans, based on a 2022 study out of Tufts, suggests, that percentage, 93% are at least, they have one marker for metabolic syndrome. So they're not, in the optimal metabolic health definition range. So may not be a great idea. There's other ways, like I said, to upregulate this FGF21. One of them is fasting. Maybe not fasting, fasting may not be for everybody. So if that's not for you, there's also fasting mimicking diets. And I know you touched on this, Dr. Kune. If you want to achieve weight loss, there's, you can go about it a number of different ways. But in terms of nutrition, you got these, 3 basic levers, according to Dr. Attia, where you could, manipulate the time component of when you eat to reduce the eating window. That usually cuts out some energy intake and can, in my opinion, I think that helps with the metabolic flexibility angle, just because when you're eating, you might be more a little, focused on glucose and glycolytic pathway. When you're in a fast, you'd be more emphasizing fat metabolism. You can also adjust what you're eating, and that's kind of what we're talking about here, where, like you had said, glucose in particular, but carbs are way, way up in this particular diet paradigm, and then fat and protein are on the low side. When I was looking into this a little bit, I think the protein intake was around half, 0.5 grams per kg, or 0.5, like half of your body weight as a target. So it's definitely on the lower side. I think most of the health and longevity research at this point, the more recent stuff, suggests 1.5 to 1.6 grams per kg, or about 0.7 to even up to 1 gram per pound. So that's one. You can manipulate what you eat, when you eat, and then the last one is just how much you eat, the calorie content. So it's an interesting assessment and experiment that some of these folks are running, but I'm positive that their goal is like, I want to lose 9 or 10 pounds. I want to get lean. I'm already healthy. I just want to kind of shed a little bit of this subcutaneous fat, this, layer that's kind of stubborn, to kind of get, body comp in a range I like it. It's not a long-term strategy for health in any way, shape, or form.
Yeah, that's very, very true, and I like the way you lay that out, because you're right. I mean, and there are other ways, and you touched on them, which would be a sort of intermittent fasting, which doesn't have to be excessive. So what I always tell my patients, because I have a medical weight loss clinic, is that try to consume all your calories throughout the day throughout a 10-hour window, which I think is very generous still, and have a 14-hour fast overnight. You will touch a little bit on autophagy. You won't go into major autophagy, but it starts already. Your body can clean house. Your body optimizes things. The other thing is, as you mentioned, every time we eat, we of course spike insulin. And when we eat sugars on a high sugar diet, we spike it more. I mean, but fats and protein will also spike insulin, of course. So I usually recommend having 3, let's say, meals and 1 snack, usually a protein shake, having a high protein diet, as you exactly mentioned, Rich. So I go for 0.8 to 1 gram per pound of ideal body weight. So the issue sometimes, if someone's very overweight, they shouldn't go with, they say, okay, what's my ideal weight? And then up to 1 gram per pound is good, as long as people are healthy. Someone, of course, that has kidney issues need to talk to their physician and clear this first. There can be some problems there. But this is my concern too. So yes, let's say you go on this high sugar diet, right? Besides, we've talked about risk of accelerating cancers, the risk of these, which we're going to get back to, the aging, which I really want to focus on, the, whole problem that we have with sugar accelerating the aging process, which is, of course, something that nobody wants. But beyond that, we're, of course, cutting back the other macros, and even cutting protein, let's say, in half. And even if these people are on massive amounts of steroids and working out all the time, at some point, they're going to have muscle loss, because you have to have the building materials for muscle. And when you go with a low protein intake, it's difficult to maintain muscle mass. It's going to be a hard one. And as we get older, the requirements will go up. We can hypothesize why that is, but I think a lot of it has to do with absorption. Our digestive tract is aging as well. That's why we have vitamin deficiencies in elderly people. When you're older, a lot of times we see vitamin B12 deficiency, even if you take a vitamin tablet, because the absorption is just slowing down. So you need either to bypass that with an injection, or you need to increase the amount you're taking in and having it in forms that are better available. But the same goes for protein. As we get older, we need more protein. When I was younger, I took in a lot less protein than now, and it was easier for me to maintain muscle mass. Now I have to work a lot harder. I have to eat more protein, and I have to decrease my total caloric intake, which for me means actually less carbohydrates and less fats, and then more protein in order to get to my rough caloric intake. So as you get older, you really need to change that. And so my concern is muscle wasting, loss of muscle mass. And of course, since you don't have the building blocks, then of course the risk of cancer. And now very importantly, of course, the risk of aging. So these molecules are actually called AGE, so which is advanced glycation end products. And they are forming when we consume sugar in our body itself. So we're sort of generating them. And I think, Daniel, you laid this out really well in this article, that this is something that happens sort of internally. Now, we also can take them in externally. So we've talked about this before, when you're caramelizing onions or you're eating a donut, anytime we have heat and we have a fat and sugar, we can certainly produce these molecules, these age molecules, and we're consuming them and they cause damage, absolutely. But on the inside, and maybe Danny, you can explain this a bit better, besides the mitochondrial problem, which is sort of, I see this as a bit of a separate issue, because these molecules form in our tissues, right? Even in our skin. And if you can explain a bit, how do we get older when we're eating a lot of sugar? How does sugar make us age faster? And what do you see in terms of what can we do to avoid this?
So imagine your bodies they have these internal factories that are making these inputs that create proteins that serve as enzymes. They serve as organelles within the cell itself. If those proteins are created and they're malfunctioning, one brick does not fit properly, or they have a tag on them that makes it such that they're not fitting within the larger contour or whatever environment they're living in, or they can no longer bind to a receptor that they typically had been able to initiate a cascade of signaling. Then the tissue can become injured if it's within the skin example. If the proteins in the extracellular matrix become dysfunctional, they're no longer kind of these proteins can cause an injury to the extracellular matrix. Then you get all sorts of structural problems within the tissue itself. And so when we have these higher concentrations of glucose, you get this tagging of these proteins that make it that they can be kind of like loose cannons. They can wreak havoc on the extracellular, the tissue that they reside in. So that's primarily what we're concerned about as we increase the the proportion of glucose within the diet itself. These advanced glycation end products become really hazardous to the tissue and kind of create this dysfunction over time. That's one of our main concerns, and we can see this in there's some testing that we can do to kind of see the level of glycation. There's a couple of companies that we've been talking to, but it really correlates with cell dysfunction, and this is one of our primary concerns when we think about it.
And once they form, can we get rid of them? Let's say they form and we've had a shitty diet, we've eaten too many donuts, we've had too much sugar intake, we have a lot of these age molecules forming, these advanced glycation end products. Do they stay with us, or over time do we excrete them?
Rich, do you want to go with the...
Yeah, my understanding is that a lot of times they do kind of shift things pretty considerably. So these advanced glycation end products, they actually have a specific targeting binding site. So it's the age-RAGE pathway. So RAGE being the receptor for advanced glycation end products. And so when that happens, it does trigger some intracellular pathways and different things occur within the cell. And I know you had kind of talked about where this comes from. Some of it's nutrition, some of it's external, and then there is some endogenous production of these AGEs over time. And it impacts skin health for sure. I know that was part of the focus of this article and this interview with Fox News, but it's not limited to that in any capacity. When this age rage pathway becomes activated, there's pro-inflammatory signals, and I know we talked a little bit about how there's reactive oxygen species that can occur as a response to that. Cytokines can be produced, so it produces some damage along the way. It even can stimulate some fibrotic pathways to become more prominent. So there's, I guess, a lot of lasting effects, including some impairments to autophagy, which is one thing that we really focus on. Like Daniel had mentioned, he was discussing that when these AGEs are either, they're too present or they, accumulate over time, it contributes to cellular senescence. Definitely within the skin, for example, there's this cross-link between collagen and elastin. Usually it's related to, you overconsume sugar or some kind of simple carbohydrate. And as a result, you can have some of the integrity of your cells actually become a lot less structurally or mechanically sound. And therefore, there's just a lot more issues with that. But I'm not aware at the moment of research that says you can actually, once AGEs are present or you're accumulating them over time, that you'd be able to get rid of them. One interesting thing that I came across along the way is a lot of people are familiar with hemoglobin A1C. That is a specific measurement of glycation end products that's linked or tagged onto your hemoglobin. So hemoglobin or red blood cells have a lifespan. So you don't really, your A1C is kind of accumulates over that lifespan, and you remove or recycle or get rid of your older red blood cells. So I think once it's kind of there, you kind of have to wait till that cell turnover occurs.
Right, and that's interesting. So I talk about hemoglobin A1C frequently, and that's, in simplified terms, it's your average blood sugar over 3 months about. And it gives us a better indication than when you do a blood test and you check your blood glucose, that goes up and down throughout the day. And depending on where we catch that, it's not very indicative. So the two things I always recommend for people, if you want to see if you're metabolically healthy, check your hemoglobin A1C, again, to see where your blood sugars are. And mine, by the way, was elevated. And even if I ate too much fruit, I talked about it in other videos. Now, fruit is still a lot better than simple sugars. When we have these sugars in a sort of matrix and you have a slower release and there are other compounds with it, it is very different than eating simple sugar, refined sugars, which we have in fast food and processed foods mostly, right? So when we have sugars that come more naturally in the form, let's say, of fruit or even honey, it is a better way to do it. But you can still go overboard there, of course, because carbohydrate consumption in the US is very high. I think in sugar, now when you read this, different studies show different measures, but I think it's 77 grams on average that an American adult eats daily, which is like 19 teaspoons of pure sugar, right? Which is really bad. Now, again, fruit and honey are a bit different. But yeah, sugar is damaging. And Rich, what you said also is very important, is this inflammation, this inflammatory process in the body. And sugar or carbs in general are the macro that is very inflammatory, and simple sugar specifically. And when we talked about, Daniel, you mentioned about cancer, of course, sugar, again, cancer feeds on sugar. We know this very well. I mean, this is established. But beyond that, cancer also needs an inflammatory environment. And that's something that is a bit new research that we're finding out right now. So in order to thrive, cancer actually doesn't want oxygen. It wants an oxygen-poor, high inflammatory environment with abundant glucose to grow. These are the ideal conditions for cancer. And that's something, again, if we know this, it is so impactful for patients or the general population to prevent cancer, but those that are suffering from cancer to understand that there's a lot of things they can do nutritionally to really, really decrease the way that these cancers progress. And that might be a huge difference for their longevity or even able to beat this disease, right, when we can control that. But yeah, this environment is very bad, and that's why we learn more and more. There's a medication that's becoming a bit more popular right now. There's a bit of research done, which is low-dose naltrexone, which is a medication we know from opioid issues that people have from addiction problems. But here we're talking about a tiny dose of it, and it's nothing to do with dealing with your opioid addiction, but it decreases the inflammatory environment of the tumor specifically. So it's very specific to these cancer sites, apparently. And by decreasing inflammation, people have remarkable improvement and sometimes much, much, much faster recovery with other modalities, of course. We always got to see these are not always strategies we use as a single intervention, but as part of something, right?
Mhm.
And we also have to understand that, Indian, a lot of people, when we talk about medicine, always think that one medication takes care of everything. That's not the case with most things. Even when you think about something simple like managing your blood pressure, a lot of times we give a diuretic, which decreases the amount of fluid you have in you. We give a beta blocker, which slows your heart down. And then you give something that dilates your blood vessels. There's all these different things that we can use together to bring something to achieve a goal. And that's the same here. But yeah, so sugar, I think, has dangers. And I think that's really important to understand that one is at the mitochondrial level, at our energy production level, because we make too much energy too fast and we're producing a lot of radical species that are not very good for us, that can cause damage. Then, of course, it's also bad because it causes inflammation, and of course, because it causes these age molecules. And that is something that not only is it compromising our tissues, but it's also making us look older. It is aging our tissues and causing a lot of issues here. So that's why simple sugars are a problem. Now, we can always say, well, we used to be able to eat more sugar and we seem to be fine. I think sugar always had been associated, of course, with accelerated aging, but people were metabolically healthier. So they were able to handle this better. And you see this in children. Children can eat sugar and they're usually fine. As we get older and as we're more metabolically unhealthy through our change in the diet that we have experienced over the last 80 or 100 years, with the onset of highly processed foods, especially, we are much more sensitive to this. And it's much more of an important issue today than it used to be probably in the 1920s and 30s. Where yes, people would eat sugar, but they also were physically more active. They had fixed meals. They didn't have processed foods. And again, what they consumed was better. Their energy expenditure was better. And they didn't have all the plastics and other chemicals that we're exposed to today, which is another factor, of course. But so overall, I think what was interesting, Danny, and you highlighted this again really well in this article, was that it's making us age. And if the idea of getting sick down the line doesn't scare you, for a lot of people, the idea of aging faster is the one that's scaring them the most, right? So, and that is certainly contributing, just like cigarette smoking, probably. Oh, Danny, I don't hear you right now. Is your microphone on?
Sorry. The children example is interesting. The children are in a developmental stage where they're growing from little children to the adults, the reproductive beings that we are as adults. So that takes a tremendous amount of calories, and that cellular programming to grow is really beneficial. Confers like for the entire species, it makes it such that we get to reproductive age. But as we get older, that growth mode, which is fueled partially by sugar and protein intake, we need to kind of tamper that down, dampen it down at least, where like we don't want to be growing this malfunctioning tissue all the time. And sugar is partially, when it's chronically elevated, is a signal for cellular growth. And we have all sorts of cells in our body. We have these damaged senescent cells and we have these cancerous cells. And if we're constantly giving the signal for growth, which sugar partially is, we are saying, hey, this constant growth stuff is going to lead to the growth of really unhealthy tissue. So partially, we talked about the inflammatory component for cancer. We talked about the oxidative stress component, all linked back to sugar, malfunctioning metabolism of glucose with mitochondrial dysfunction, more electron transport chain emitting these reactive oxygenated species. We see kind of sugar at being kind of like the center of all these things. So writ large, I'd say, like, from a prescriptive standpoint, it's like you get most of your nutrients from unprocessed foods because they have the mitigating pieces with fiber and protein that kind of make it such that we can digest sugar in a way that's not going to spike your glucose levels. I think Brandon and Rich can speak to this because they develop the program for our patients of how to like really think about how do you want to get your sugar intake.
Yeah, I think one of the problems is that when you look at things like probably even uric acid, for example, if you trace back to like the 30s, 40s, and don't quote me on the date range, but the normal level at that point, the healthy level, was like in the 3s and 4s. And now you don't get diagnosed as unhealthy or in trouble from a metabolic health standpoint until like, I don't know, maybe 6.5 or 7. And it's probably even at that point through the lens of gout. And we know that uric acid is a byproduct of fructose metabolism. So even if you are having a ton of fruit, even if you're having processed foods that have high fructose corn syrup, you are marching yourself in a very terrible direction, which I don't think people are relatively aware of. And it's unfortunate that the information that we're fed now is like the ranges that are healthy are indicative of the health of our population, which we know is not healthy. And so that's one of the pushbacks that we get pretty frequently when we do lab reviews with our patients, is that, you know, you might get your spit out from LabCorp or Quest or whatever it might be that's like within range, all good. And then you get the Healthspan result and it's like, could be a little bit better. And that's intentional, not to be, you know, a-holes about it, but to kind of move you in the right direction. And the reason that you have come to us from the get-go. And things like LDN specifically, Dr. Kune, because you brought that up, is supposed to be anti-inflammatory. So it's kind of a marriage between the endorphin production and the immune system at that point. And so when you take this in very low doses, which LDN, low dose naltrexone, suggests, not the opioid or alcohol addiction, it kind of binds to that receptor short term and then boom, releases. And so there's this upregulation of the endorphins, which are natural, nasty cell killers by their own right. And so you tend to reduce the inflammatory markers, hopefully the nasty potential cancer cell markers, all the fun things that come along with that, which hopefully is a win. And we would see that pretty regularly in what we would hope are regular lab results that we would ask patients to get too.
Right. Yeah. So the interesting point then is like, how do we avoid having too much of these molecules forming in our bodies? How do we avoid the aging process and the disease development? And of course, we're all drifting more towards type 2 diabetes. And I was in the same boat. My hemoglobin A1C at some point was above 6.5. And the interesting thing now is, as you mentioned, other labs, you know, a lab value, when we look at a reference range is usually you take a part of the population that we are assuming is healthy. Assuming, I'm saying, because now, as you mentioned, maybe 80% or more of people are slightly metabolically unhealthy. And we're taking an average of these people and say that's about right. And it used to be that we wanted the hemoglobin A1C to be under 6. It was even under 5.8, I think, at one point. Now it's 6.5. So we're moving up. So instead of saying, hey, you know, maybe we're becoming unhealthy as a population and we should really focus on this more, we're just adjusting the range. And we're doing the same thing with testosterone, by the way. Our total testosterone now is lower in the population. And again, what do the labs do? They adjust and say, hey, no, yes, I think you're fine now if you're within this range, which if you compare this to our grandparents would have been pathetic, right? And that's, I think, a big mistake, is like we're justifying it. And we did this before when people became obese. We were like, well, maybe we should just expand and, you know, maybe increase what BMI is good and all that. No, but we know that there are health consequences to all these things. There's health consequences to eating too much sugar, which we just discussed. There's health consequences to allowing us to drift towards this metabolic problem. And then if on top of that, we're eating a diet that is high in simple sugars, it's not good for us. So in my patient population, I usually recommend not to consume any simple sugars, but focus on fruit. You can have some honey. Other sources of carbohydrates could be simple as oats. That's a bit controversial, people, because they think it's not very, most people think it's not very nutritious, and that's true. There's not much in there, but it's a very satiating food. It doesn't have the typical gluten that we have. It has something called avenin, I believe, which is a different type of gluten, which is much easier digested. So that's another carbohydrate I'm usually okay with. Even a slice of bread, if it's a whole wheat bread that's organic, that's important, because otherwise you spray it with all kinds of crap you don't want. And then rice in moderation. Rice, of course, high in arsenic. We got to be a bit careful there. But if that's your carbs that you take in, and you're avoiding the simple sugars, I think that's great. And then you shouldn't also drink anything with sugar, even with sweeteners, because that's a downfall. We can consume a lot more calories when we drink them than when we eat them. And there was this actor that prepared for a movie part. I read this was fascinating, and needed to gain a lot of weight. It was, of course, very unhealthy. And he couldn't do it. He said, I can't eat that much. So he ended up drinking ice cream. So you had these tubs of ice cream. He warmed to room temperature until it melted, and then would drink that with a straw, and therefore was able to consume all these calories, right? Because again, we can consume a lot more, and we don't think about it. You go get one of those expensive smoothies, and I went there with my kids, you know, and it's $12, $15 or more for a fruit smoothie, it's supposed to be healthy. It has some vegetables in there and some spirula and greens, and then tons of fruit. And once we blend them, again, we take them out of the matrix that it's in when we eat them. It's a different situation again. Now we have the sugars kind of in there, and fruit, of course, has fructose, yes, but also glucose. It has both. And we can really, really increase those crazy. So I would just cut all that out and just drink things like, tea or coffee in the morning and then water, and don't put anything in it. No sugars, no sweeteners, no nothing. And then focus on your carbs from good sources. I usually stick with 100 to 150 grams of carbs a day, which of course is not a very high amount. I think the average American now is 350 to more actually per day at total carbs. And then good protein, we talked about 0.8 to 1 gram per pound. I think that's a pretty good range for your ideal body weight. And then fats, yes, are healthy if you have good fats, not those polyunsaturated fats. I don't like those necessarily, but even there, moderation is key. And if we overdo the fats, it's an issue. Now, the worst combination is a donut, unfortunately. You have heat, you have sugar, you have a bad fat. We have a polyunsaturated fat, which is highly unstable in high heat. A lot of double bonds that can react. And and then you get some flour in there. And if you eat that, that's kind of one of the worst things. Besides French fries, I think that's another one.
Yeah.
These are things. But I think that's really good. And it's good to point out, yes, you can lose weight by restricting 2 of the macros and focusing on one. But that works with any of them, really. There was the potato diet that worked. There was an egg diet.
Yeah.
Not sustainable. Of course, the sugar diet sounds great because everybody loves sugar. It's sweet. It's great. Yeah. And oh man, you can go crazy. Who wouldn't like that? And then saying, oh, it's actually good for you. Look, I lost all this weight. It comes with a high price. And I think besides the setting yourself up for a lot of disease, setting yourself up for high inflammation, muscle wasting, and then you also, of course, have these age molecules that are forming, which make you age faster. So probably a bad idea. I think it's good to shed some light on some of these because people will follow this. And sometimes people are stuck and they can't lose weight and they do this and now they feel they lost a lot. But you need to lose the weight sustainably and be healthier at the same time and not age faster. You want to age slower. That's the whole thing. And it's not just externally, but you're also aging on the inside. And these are real issues. I think that's very well highlighted. I appreciate it. And again, love the article. That was really fantastic.
One thing I just wanted to say, like, one tool that I think everyone should utilize at one point or another is a continuous glucose monitor, because it really drives behavioral change. Because you can see I ingested this donut. How did my blood glucose levels change? How we interpret like the meaning behind those increases of blood glucose levels, those spikes, is one thing, but just to be able to make those associations, it's a really powerful tool. And if you can do what you're doing here is kind of provide some educational context of, particularly with body composition, of like, you're getting a corresponding increase in insulin levels, what that means for fat oxidation, it's going to be harder and harder to burn fat. Those are, if we can educate folks on how these systems work, but also give them the tool to actually see the connection between what they're eating and how those levels are changing within their body. I think that's a really, really powerful tool. I think that's something that Rich and Brandon have utilized with thousands of patients over the course of their career, and really are seeing really great results.
Yeah, I think that's a great point. When you can actually see what it does right by consuming something, what the impact is, right? How your blood sugars are spiking, and understanding too that the more we do this, every time you spike blood sugar, by the way, again, it spikes most with carbohydrates, but also with other macros. Insulin is of course released, but it also triggers fat storage, right? So you have an issue. And one problem is then when you continuously throughout the day, when you're snacking between meals for a while that was promoted, you continuously spike your insulin. And besides storing fat, you're also burning out your pancreas. And one manifestation, when we think of type 2 diabetes, is really you're burning out the cells in your pancreas. You just can't make enough insulin. You would develop resistance to insulin, so you eat more and more and more. And at some point, the pancreas says, I've had it. And then that's it, right? So you're right. When we have a continued glucose monitor, it's fantastic. You can stick this on and it'll give you feedback, and it's on your phone, I think, right? It's very high tech now. Yep. You can see this, and then this hand comes out and slaps you when you had that donut. Yeah. But see how really this spikes up. And when we then understand, every time we spike our glucose very, very high, it causes problems, which we don't want. And that's why when we eat the complex carbohydrates, which I think are fine to eat, again, it's a slow release of this sugar, and you don't get this massive spike. You get a slow rise of your sugar, and then it comes down pretty fast again, as insulin is released appropriately. These are big differences in how the body behaves, right? When you give a lot of this energy coming in, you're messing up the mitochondria. It's like when you run a car and you run it with what they have nitrous, and you run it with like high octane fuel. You can do that short term. You can do bursts of it, but you're burning out your engine. There's only so much the engine can last after that. It's too much energy that comes in, and that causes a lot of junk being produced that damages your body, makes you older, makes you sick, right? So it's important to understand that. So yeah, I love that idea, having the continuous glucose monitor. I think that's a great tool to have. Makes a lot of sense in order to monitor and really understand it a bit better. Yeah. But yeah, I think it's very interesting. It's a fascinating topic, obviously. And again, being healthy, losing weight is important, but it needs to be done in a way that doesn't damage your body, right? And when it's drastic in a way where we're restricting things, and unfortunately we see this with some of the GLP-1 medications now. Why do people have muscle wasting on them? They have muscle wasting predominantly because they get nauseous, they can't eat very well, they're really not hungry, but they're cutting back on protein dramatically. And we see that is detrimental, right? When long-term muscle wasting in the face, and that's part of Ozempic face. It's not just fat loss, it's also muscle loss in your face, up to 50%. So that's not a good thing to do. So if you're losing weight, especially at a fast rate, you need to optimize your protein, and you need to increase resistance training massively.
Yeah.
And the sugar diet does not address that. So, like you said, insulin's a fat storage hormone. So I would love to see anybody that's trying this, if you were going to try it, do a DEXA at baseline, do a DEXA again at 4, 6, 8 weeks, whatever it is, and tell me that the weight loss that you're achieving is worth it for your longevity. Because if you're losing your lean muscle mass as you age, you're doing the wrong thing.
As well as bone density. You lose bone mass and muscle mass. And I think the issue I see with this, actually, when it's so extreme, whether it's the sugar diet or if people are eating poorly when they're on a GLP-1 agonist, when you're over 40, let's say, and you have a sudden loss in muscle mass, and again, this could be up to 50% of the weight loss that you're experiencing, but also bone loss, that is very hard to recover. It's not like that is easy to come back, like it's almost impossible at some point to catch up. And when you're in your 50s and 60s, really bad. And then you have fractures, and you have other issues that come with this. And this muscle wasting can lead you to weakness in your legs, which then at some point they put you in a wheelchair, and then it's downhill. It's not a good idea to do that. But even in young people, there was a young actress who posted that she was on a GLP-1, and I think she was a singer and had to lose some weight because of the managers that told her to get on this. And she had osteopenia, so bone pain, and she had osteoporosis at a young age. She's in her 20s. So you have bone loss and muscle loss, and these things are what we should fight to keep as we get older. And this is detrimental by switching to a predominant simple sugar macro diet. We're really amplifying this deterioration of tissue, and a lot of times you can't really easily recover from that. So I think it's an important point to do. Besides all the other risks we outlined, higher risk for feeding cancer cells, higher risk for developing type 2 diabetes, higher risk for all these other markers, and then the aging of tissue, the problem with the collagen distortion in the skin by these H molecules that form, right? Yeah. Again, that's something that we may not be able to get rid of over time. And the best thing is to be mindful and start early, even in children. Talk to them about the risk of this, because they're going to go through their teenage years and might gain some slight weight, but these processes start fairly early. And as Danny mentioned, yes, for children, you need some growth signals, and they're usually okay with some higher amount of carbohydrates coming in, because they have a very different growth signaling pathways that are going on. But when you're grown up, it works very much against your health. The
one thing I want to double click on is the muscle thing. So everything we talked about from the perspective of the inflammation, mitochondrial function, muscle is the antidote to those things. So when you have muscle, it becomes like an endocrine tissue. It releasing, when the muscle contracts, we release these things called myokines, which are anti-inflammatory cytokines. There's muscle acts as a reservoir for glucose. So you eat that meal, that high sugar meal. Well, if you have a lot of muscle, you can utilize that glucose. It can be the reservoir where it kind of sucks that glucose in. So as much as possible, any longevity regimen should prioritize resistance training and the consumption of that protein, such that you can actually maintain muscle over time, and hopefully it becomes you're adding muscle as well. But I think that we should definitely like bookmark that piece, because it's such a crucial longevity tissue. And I don't know, Rich and Brandon, if you have anything to add to that, but I think that's one of the downsides against the GLP-1s. If they're not done properly, we don't prescribe GLP-1s at Healthspan because it's a really delicate, nuanced medication, and this piece about muscle wasting is a really big concern. So you'd have to do it in a very precise way. But Rich and Brandon, do you have any thoughts on the muscle piece?
I do know I guess I come back to this. There's this 2016 paper that did a dietary comparison, looking at lean mass loss and fat mass loss breakdown from different diets. Very low calorie diet, low carb, low fat, high protein, high fiber. So they looked at a range of these different diets. It seemed like in an ideal scenario, if you have a 75% reduction by total mass loss of fat mass, you did really well. You really, you kind of optimized that nutrition. The only exception to that rule was a high protein setup where, usually the split's like 75% fat loss, 25% lean loss, because it's quite difficult. It's not an impossibility, but on average, people, when they're losing weight, they're not only losing fat mass. But the high protein diet did achieve an 89% fat mass loss with an 11% lean mass loss. So that nutrition signal that you provide is crucial. I know Dr. Cune mentioned resistance training. You could argue that perhaps the resistance training is equally or more important, but either way, that nutrition signal is huge. So it's hard to overstate how important that is. As you age, it seems around mid-20s, 30s, perhaps, your bone and muscle has peaked, and therefore, without the right nutrition, the right resistance training, you then begin your decline in terms of bone mass and muscle mass. And the ideal or the optimal would basically be to stall or get that peak as high as possible in your more young adult years, so that you can live longer, healthier before you kind of reach these clinical thresholds for osteopenia, osteoporosis, frailty, because at that point you kind of are, options are maintain or decline, and decline is the more common of the two options that you have.
Yeah, kind of like a 401k, right? Like you put as much in as you can while you can, and then there's an inevitable decline. You retire, you do what you're going to do. It's not like you're still working potentially after you're retiring while you're tapping into that. And that's kind of the same thing that happens with your muscle mass and your bone density for that matter.
Mm-hmm. I think that's a great point. So the GLP-1s, I don't prescribe them either in my clinic. And again, I'm not against them. So it's funny. So YouTube and all these channels, they're very much, they like them a lot, let's say, because the industry likes them. This is not based on necessarily what they do, but there's a bit of a push of the industry to put everybody on them. And again, there's a patient population that will do very well on them. I've had some patients that were getting them from other prescribers, and it worked well for them. But the key thing to understand there, what do they actually do? They just make you eat less. They make you restrict your food, right? And if you restrict it in the wrong way, where you're cutting out protein too much and you're not resistance training, then you have this massive decline in muscle and bone mass. And that's important when you mention resistance training. Resistance training doesn't just build your muscles, but it also builds bone, because muscles are attached with tendons to bone. And the skin around the bone, as the muscle pulls on it, gives signals to the bone to incorporate more calcium, to really, really make the bone more functional again. Bone is actually very vascular tissue. It's very active tissue. It's not just this calcified thing that we think of. It's a very important tissue to maintain. And if we don't, a lot of problems happen down the line. So I think that's a very good point. When we're restricting, when we're not having an adequate intake of the essential nutrients, which really are your proteins and your fats, when you not having a sufficient amount of that coming in, and you're having a surplus of simple sugars, then you can cause a lot of problems. And as we age, again, one is the external aging, but also these internal factors that are happening, accumulation of these molecules, and then the deterioration of muscle and bone mass, which is certainly something that we absolutely need to avoid.
And we saw that quite heavily, at least in the small cohort of the breast cancer patients that we had. When you looked at their percentage of body fat, when you looked at their vitamin D, when you looked at their calcium, it was like almost non-existent. Well, percent body fat super high, but like the vitamin D, the calcium, the bone health stuff from the DEXA was just terrible. Like you would think those numbers were almost made up.
Which is the other thing in really most cancer patients, unless they supplement, they will have low vitamin D levels, which are really problematic. And most physicians don't address this because we're really not trained to deal with nutritional factors so much because we ignore them, right? But vitamin D, especially with K2, is hugely important. And especially in someone with cancer, they would, of course, get tested ideally or ask for it and say, hey, when you do my blood test, please test for my vitamin D levels, right? Because they most likely will need to substantially supplement, and which can greatly improve their progression and also their chance for remission. You know, massive difference. It's another thing that's overlooked. But you're right. And as you lose muscle, as you lose bone, one of the things why we lose it at an accelerated way is a lack of vitamin D. So very, very crucial nutrient. We don't get sufficient amounts from sunlight anymore. We're not outside enough. There's not enough UV light in the winter months. I think there's a good need for supplementation there as well. But yeah, all these factors need to be taken into consideration. Just simply cutting out some of the macros and focusing on one is rarely a good idea. Again, we can talk about a ketogenic diet that has clinical applications because there, again, when we cut out sugar and the, let's say, presence of cancer or other diseases or seizure disorders, there's some clinical benefit there. But that benefit, unfortunately, has not been established yet for high amounts of sugar. Although it sounds fantastic, right? But unfortunately, it's not out there.
I think I almost thought this was preposterous when I heard about this. I was like, it's like we're going to be talking about a high sugar diet. What is happening here? Yeah,
it's right up there with the vodka diet, you know.
The vodka diet.
Yeah. Short term. Yeah, as you've seen, a lot of alcoholics will be very thin, right? But that's because they're completely deprived. You know? So all not a good idea. I think we can all agree on that. I think it's important to highlight this. It's just like I don't want people to drift off into some really extreme form of diet, even short term. I think you can do damage even short term. Even for a few weeks, people will say, "Oh, just do it for a few weeks and lose some weight, and I'm good." In these few weeks, you can do massive damage to your body. And it might not be evident right away. If the only thing you're looking at is the number on the scale, you're missing out on many other factors that are really going downhill, including accelerated aging. And I think that scares people more than anything. So, all right.
I think you should feel good while you're losing weight. So if you're feeling good, that's a good indicator, a functional indicator of like, are things from a systemic level going in the right direction? So that's one just kind of like thing to check in while you're losing weight. Am I feeling good? So it's something to think about.
If you don't, then you're not going to sustain this. If you feel lousy on your diet, and that I've seen this also with some patients on GLP-1s, they say, I ate very little because I was nauseous the whole time. Yeah. So if that's the case, that's not great to sustain even that long term. And at some point you're going to be like, I'm done with this. I felt bad, and that's not going to be possible. You should feel great, yeah. And that's why we brought this up earlier with meal size. I think Rich brought this up. I recommend to actually start in the morning with your first meal about an hour and a half, 2 hours after you wake up, which should be a very high protein meal, the big meal that's very satiating. You should be full after your meal. And then the second, third meal may be slightly smaller, but distinct meals. But don't eat too little, because then you snack between, which again we talked about is not good because you constantly spike your insulin throughout the day. So rather have fixed meals that fill you up where you're full, because psychologically, if you never eat a meal where you feel full after, it's, I think, a problem. And the first meal helps. Some people that do one meal a day, which I don't quite agree with. Here I must say this as well. This works for some people. And there I can see if you have a good quality one meal over an hour, maybe. I mean, again, I think it's hard to really get all your nutrients in 1 hour throughout the day. But there's some people where this works, and I'm not criticizing that, because at least here you can determine what your composition of your food is. You can have good foods there, right? It should not be a high sugar meal, obviously. But in general, if you have at least one meal where you feel really full after, psychologically, you're not going to have these cravings as much, and you're much less likely to crave foods later in the day. So there's something to be said about that. So absolutely, Daniel, I totally agree with you. We need to feel good throughout this process, have a good composition of the diet, but also really not to get to the point where it's painful or horrible, or we don't like what we eat.
Yeah, totally.
I think one of the things that we often find is that when we at least have like this low carb lens, potentially ketogenic diet lens, is that people don't truly understand how shitty they currently feel until they make some kind of minor movement in the right direction. So even like working with a patient currently who had an A1C of 9.9 2.5 months ago, he said, yesterday I just talked to him, he said, Brandon, I haven't gone on a vacation in 3 years because my joints hurt, my muscles hurt. I didn't feel like doing anything. He's like, I just went on a trip with my wife last week, and I can give you like an anecdotal 50% of my pain, my joint reduction stuff, 50% done, like just from this last 2.5 months. And his estimated A1C, not a blood draw, but was down to 8.1 over 2.5 months. So I think
big difference. Yeah.
Huge difference. And that's, still high, still super elevated. But the fact that he felt that shitty 2.5 months ago, went on a vacation, 50% reduction in his pain. And like, that was, he's turning 50 in 2 months. He's like, I want to be, type 2 diabetes reversed, done with this, like turn 50 and be on my way. And I'm like, hell yeah, man. This is awesome.
And that should be the goal, feeling better. And then as you feel better, you move more, you move more active and everything.
The virtuous cycle.
Yeah. Well, fantastic. Well, thank you all for getting together for this. I think very important topic.
Yeah,
appreciate all your input again. So again, these guys are researchers with Healthspan, gethealthspan.com. Very great crew here. And all of them really experts in their fields, and they're really focused on making people feel better as they age in a healthy way and have a longer health span rather than just a longer lifespan. I think that's a very important point.
Thank you, Dr.
Thank you, gentlemen, so much. Okay.
Yeah.
Thank you.
Appreciate it. Pleasure.
Bye.
Bye.